When we're talking about fevers in children, there's a lot of misunderstanding about what the fever actually means. And it has less to do with the height of the fever than it does with the symptoms that are associated with the fever. So if your child has a fever of 101, really doesn't mean a whole lot different than if they have a fever of 104. It's more a matter of, are they eating well? Are they drinking? Are they acting normally? And the same goes true for when you're treating the fever. If the fever is whatever temperature, your child's going to look more lethargic, less active when the fever is elevated. But if you give them a fever medication like Tylenol, acetaminophen, or Motrin, ibuprofen, the expectation is that if it's not something terrible, they should look a little bit better when the fever comes down. But the interesting thing is that most parents don't really make the connection that how much the fever comes down is really not any indication of how bad the illness is. So if your child has 103 fever and they look miserable and you give them a dose of ibuprofen and an hour later it's 102 and they look a little bit better and they're still feeding well and they're not having trouble breathing and they're acting better than they were, that's a good sign. The fever doesn't have to come down to 98.6. That's a misnomer that a lot of parents have, that if they treat the fever, it must have to come back down to normal. So when you're dealing with your child with fever, much more important for you to recognize that your child has a fever, and really, if they feel warm to you, from my standpoint, when I take care of kids at KidMed, that it's as important to just recognize that they have that fever and less important to know what the temperature is. The reality is there really is no temperature that is more worrisome than another fever, unless you're getting into the 105, 106 degree range, and then there's some other illnesses that we think about. But a lot of parents get nervous thinking that when their children have a fever, especially if it's in the higher range, that therefore there's a risk of a seizure. And what we do know is that when kids have fever-related seizures, or what we call febrile seizures, it actually has everything to do with how quickly the fever goes up and very little, if nothing, to do with the height of the actual fever. So if you are treating the fever, you're giving your child Tylenol or ibuprofen, or if you're doing what we do at KidMed, which is to recommend alternating them back and forth between the two, the likelihood of the fever going up quickly is actually pretty small, and the risk of a seizure is very small. With the kids that have febrile seizure, luckily we know that occurs only in the early years. Really, you don't see it beyond age 3 or 4. So in kids who are above that, it's not even an issue to worry about. In the younger kids, as long as you're managing the fever, it's okay. Now, when would you bring your child in for a fever? It goes back to what I was saying initially, that if your child's not feeding well, let's say your child's throwing up or having diarrhea and they're just not taking fluids in, that's a reason to be seen. If your child's doing a lot of coughing or sneezing and you notice that they're having labored breathing, they're working really hard to breathe, using their stomach muscles, their neck muscles to breathe, that's a reason to come in. But if your child has a runny nose, or if they have a little bit of a decreased appetite, but for the most part they're acting pretty normally, within the first day or two of a fever, it's okay to just treat that symptomatically with something for fever control. Once you go beyond 3 days of fever, we usually do recommend that your child get checked out. Most of the viral stuff that we see that's pretty benign lasts maybe 2 to 3 days, maybe a little bit longer sometimes, but around the 3-day mark is when you ought to at least have somebody eyeball your child and take a look at them. Now, what testing would we do? It really depends on what your child's symptoms are. If we're in the middle of flu season and your child has typical flu symptoms, we may go ahead and check for that. If your child is a young toddler or infant and they're having breathing difficulty, we may or may not test for the RSV virus, which is a commonly talked about virus that can cause respiratory difficulties in some children. Doesn't change the management a whole lot, but parents oftentimes will want to know if that's what their child has. Certainly this time of year, we're seeing a good amount of strep throat. There is a lot of pneumonia that is still out there, and that's something that if your child has the fever for more than 3 days and has a cough, we ought to go ahead and take a look at, because the kids that we're seeing now at KidMed that have pneumonia, actually most of them look pretty good, and they don't look like you would typically expect a child with pneumonia to look. They have the cough, they have the fever, but they really don't look bad, and lo and behold, you get an x-ray and there's a large pneumonia on there. So something to look at. That's a very treatable thing too as well, so nothing that parents need to get terribly worried about, but it's something that would be treated differently.